everyone focused on what has happened in Washington, D.C. over the last couple of days, but let us not forget that a uncontrolled pandemic still rages across the country and across the globe. Yahoo Finance's Anjalee Khemlani joins us now with some of the latest headlines on the pandemic. And Anjalee, let's start with new variants of COVID-19. We've had this conversation, the two of us, many times, where I don't exactly know how to read these stories, if I'm supposed to be more alarmed, if I'm supposed to still trust that the currently approved vaccines will be effective. But where does that stand? Because as time has gone on, again, continued to get more information about new, I guess, tweaks, we could say, in the virus.
That's correct. And to the answer about the vaccines, that's still being worked out. We know that last week we got some indication that based on the studies ongoing, that there was some proof that at least one of the tweaks, right, to that to the virus is able to be blocked by the vaccines. That news came from Pfizer. We know that both Pfizer and Moderna are working hard to get us that information. I'm sure the other companies as well are, even though they're in the middle of trials for generally COVID. We do know that as of right now, there is only a focus on the UK strain largely here in the US. Globally, there is a little bit of concern about that strain from South Africa, but we have not seen that here just yet. We also know that there is some news out of Japan for a variant. Now, a really cautionary note here, this is all just observation at this point about a U.S. strain. There were reports about that on Friday based on a presentation that had been made to the governors from the White House task force. We did hear from the CDC saying very specifically that no strain as prominent driving cases like the UK strain has been present in the US, even though, as we've mentioned repeatedly, over time throughout this pandemic, there have been multiple strains. So that is just sort of where we stand right now. We are going to get more information as it comes along, but nothing key out of a domestic strain just yet. And while we do see these mutations, it does seem like it's more driving cases than, say, driving an increase in deaths just yet. We don't know too much more of that just now. So a lot of still wait and see, unfortunately, all over again. Meanwhile, we know that across the country, cases are rising at a rapid rate in almost every state, causing even more concern post the holidays as we start into the new year. Well.
And, I want to get a vaccine update from you as well, Anjalee, because according to Bloomberg, 8 million doses have now been administered in the U.S. Just to recall, of course, 20 million was the target by the end of last year, which obviously we didn't make. And Governor Andrew Cuomo of New York said you can sort of broaden now who can get the vaccine after it sounds like there were doses getting thrown out because you couldn't find enough people to meet the criteria. So what is that? Why is that happening, first of all? And what is this going to do to sort of open up and get the vaccines to people who want them?
That has been a cause for concern for quite some time. There have been some experts who have warning that without this goes back to not having a full federal oversight of how things are being distributed and leaving it at the state level, even though some on the other side of the argument say the public health system and state level should know better where to distribute doses. But it seems like without any sort of efficient tracking system and without any efficient follow through from the federal government and sort of, shifting where the needs are, there has been several reports of not just doses going to waste, but people knowing that there are these excess doses and sort of jumping the queue to get theirs when they're not even qualified to get the vaccines. So it does seem like we're going to be dealing with this for some time. There seems to be no fix for it, but it is a concern, and it again goes back to state level, whether or not the states decide to change the rules or help guide the doses through.
All right, 10 days, and then the 100 million doses in 100 days begins, I suppose. We'll see how that goes. Federal government starts getting more involved. All right, Anjalee Khemlani with the latest headlines on the COVID-19 pandemic.